Greetings everyone, and welcome to this short 15-minute preview of the 9th Annual HPAPI Summit Workshop on Occupational Risk Management, where we ask and hopefully answer the question, what good are OELs anyway? For the BioRisk Sciences team at Shapirian Toxicology, I'm Mark Maier, and I will be your coach for the Summit Workshop. So what if you guys could do most of your own occupational exposure limits and OELs all on your own, quickly and simply on your schedule? Or what if you could make sure that an OEL from your consultant makes sense for your facility? And what if you could quickly translate an OEL into a risk management plan for your facility? That's what this workshop is all about, and I will be your coach to help you explore and tune up your own risk management thinking. This workshop is designed to be interactive, and we hope participants will share their own experiences and methods, and of course always challenge any of my ideas. But before we start this preview, let me tell you why we want to do this workshop in the first place. And there are two main reasons. One is because clients keep asking us why our exposure limits are higher, and sometimes why they're lower, than another consultant's OEL. And then they expect us to get on the phone with the other consultant and fight it out until we agree on a number, which, as you will see, is really not the point. And second, some of our clients actually go OEL shopping. They find someone to give them the number that they want, but when they do that, they create a whole new dilemma for themselves. You know, should they take the lowest OEL and work in an isolator just to be safe? Or should they take the highest OEL and then worry about whether their workers are safe? The bottom line is both approaches are wrong. If you want toxicologists to agree how risk assessment should be done, first of all, they usually won't. And if someone is shopping for an OEL they want, they don't understand what an exposure limit is supposed to be. Exposure limits, despite the unfortunate name, really have just one purpose, and that is to guide your thinking about risk management, not to define it. If you've ever used government exposure limits, you already know that OELs can vary depending on which agency did the risk assessment. So it really should be no surprise that your API exposure limits will vary depending on who did them. And exposure limits are not lines in the sand that can't be crossed. Exposure limits are based in science, but they are not themselves scientific. They are judgments. So in our workshop, we will explore and we'll do the science and we'll make the judgments, and we'll craft risk management plans based on those judgments. And we'll also look at some of the mythology that goes along with exposure limits. And finally, we'll pull it all together into what matters most for you, and that's managing exposure risk in your facility. So this virtual meeting format is going to be absolutely perfect because you will be able to practice everything we do and everything we talk about on your own computer, and then you can ask real-time questions, get real-time answers, or you can circle back later. But either way, this is going to be a great experience. So let's get started with a short preview of the workshop so you know what to expect. And let me start with a question. Did you know that adverse effects associated with API exposures in pharmaceutical manufacturing doesn't even make it into the top 5 causes of worker injury? It's true. Most pharmaceutical manufacturing injuries are physical, ergonomic, or related to reagent exposures, not to API exposures. And this makes sense because APIs are meant to be given to humans, and by the time you see them in your manufacturing facility, most of these molecules have already been through a lot of development to do one thing: improve safety. And we can use that knowledge to our advantage when trying to figure out OELs. And I will bet that many of you have lots of experience in chemistry or engineering and maybe mathematics, and that you see numbers as being generally accurate. Things like weights, charging ratios, pressures, flow rates, temperatures, and so on. But here's the thing. OELs don't work that way. And that's because they are based on biological responses. And biological responses cannot be measured accurately. So let's start with a familiar example. Hunger. You know, that signal that tells us when it's time to eat. It's a perfect example of a biological effect that can't be measured very well. And not only that, nobody else can tell when you're hungry. and that's known as a symptom. And by the way, you can't measure symptoms in animal studies because, well, animals can't tell you how they feel. And things like this turn out to be really important when establishing OELs from animal data, especially for APIs like antipsychotics that may cause neurological symptoms like ideations of suicide. As you might imagine, it's pretty hard to tell if an animal is having some kind of ideation. So anyway, back to the hunger example. So how hungry are you right now? And what scale would you use to decide how much food to order? 1 to 100? 1 to 10? 1 to 3? Well, if you use 1 to 100 and your hunger level is 28, what does that exactly mean? And will that tell you how much food to order? Probably not very well. And that's exactly the problem with most OELs. They have false accuracy built into them. So in our workshop, we will see how that happens, and we will talk about what you should do to deal with that. And the worst part of this whole OEL process is that toxicity measurements, as imprecise as they may actually be, are really the most accurate part of the whole OEL process. And what if you don't have toxicity data at all? Well, there's an app for that, and together we will use those apps in the workshop to develop OELs. But here's the main point, and you will hear me say it again and again. Manufacturing safety comes down to how well you manage risk, not how accurate your OELs are, or for that matter, whether or not everybody agrees on your number. And most importantly, thinking about OELs as accurate may actually increase risk related to ergonomics or to mishaps, because that happens while you try to deal with all the complications of containment that you may not actually need. And remember, as I said before, API exposure injury doesn't even make it into the top 5 causes of pharmaceutical worker injury. So you might say, okay, Mark, so if you're so sure that we should not think about OELs as absolute numbers, how would I know if you're right? And if you are right, how should we use OELs? Well, the best way for you to know if I'm right, and more importantly, the best way for you to know how to use any OEL in your own risk management programs is to know how to develop them yourselves. You need to know what goes into making that OEL sausage. So the most important outcome for our workshop will be your ability to derive your own OELs and then decide how much confidence you have in any OEL, yours or somebody else's. And that way you can decide if you're okay doing them yourself, or whether you need to ask your expert for clarification, or in some cases, whether you may need to get a second opinion. And that's what we will do in the Summit workshop. We will work through a rather simple 3-step process that will show you how to develop OELs for yourself, and that way you can evaluate whether any OEL from any source is right for you and for your facility. And it also means that you can develop many OELs really fast on your own, and then if you need expert assurance, you'll know exactly what questions to ask because you will have already thought through the process. And that way you can focus on what really matters in your facility, and that is, yes, risk management. So all exposure limits come from the central dogma of toxicology. You've heard it before, dose and response. More dose, more response, simple idea, right? So dose and response are the first step in our OEL process. Did you know potent is actually a dose response term, not an advertising claim for an API or a summit? Do you know what potent really means? I can tell you it probably isn't what you think, and we'll talk about that. And did you know that so-called selective and potent drugs that you often hear usually aren't either of those things? In our workshop, you will see why this is so. And what about cytotoxicity? I hear that term all the time. Nobody really seems to know what it means, But even the best modern oncology drugs are not very cytotoxic, at least not towards normal cells, and that's the point of their design. So should you even use cytotoxicity as a criterion for your risk management plans? Maybe not. So I think alcohol is a great example of a dose and response. And we will start with alcohol in our workshop because it's familiar. And so how do you get started researching an OEL? The first thing you have to do is to be able to search for information on your molecule. And you will learn how to do that in an easy, step-by-step method using open source apps and free scientific literature. And we will work through examples together. We will use the free apps to help us identify special hazards like sensitizers and mutagens and teratogens. And I will show you how you can manage these special hazards by doing one single thing in your facility. And then once we get our toxicity data gathered up, then we can really get into the sausage making business of risk assessment. And by the way, they don't teach real world risk assessment in PhD toxicology programs. So all toxicologists are not created equally regardless of the letters after their names. Risk assessment is a practice just like law and medicine, and it is learned, yes, by practicing. In our workshop, we will practice some easy risk assessments, and then we will finish up by doing at least one really hard risk assessment. That way, you can see for yourself when and if you may need to get expert help, and you will know exactly what questions to ask your expert because you did it. And finally, the third step in our workshop will be risk management planning, which is the only thing OELs are really good for. Do you know that the definition of an OEL is about 80 years old? And it's based on the way things were done after World War II? An OEL is still defined the same old way, the maximum exposure that is safe-ish over an 8-hour workday, day after day, for a really long time. But how many of your pharmaceutical batch campaigns go on for a really long time? How many of your workers grind away at the same process 8 hours, day after day after day? And what about batch sizes? Are you making 100 kilograms or are you making 10 milligrams? And what about analytical batches and substances in solution? Shouldn't all of that matter in how you implement OELs to manage risk? And the answer is yes, absolutely it matters, and we will talk about that in the workshop. And what about PPE? The old industrial hygiene mantra says, you should never use PPE as an engineering control. You ever heard that? It's certainly what I was taught, but here's my question to you. Is a NASA spacesuit just PPE? Or is it a highly engineered exposure control? Much of the NASA spacesuit technology is baked into modern PPE that we use in pharma. And shouldn't you be able to use highly engineered PPE as an exposure control? Well, in my opinion, the answer is yes, sometimes. And you can always use PPE to mitigate uncertainty or differences in your risk assessment. And all of this matters greatly to how you manage risk and how your strategy is constructed. And all of this matters more than whether your OEL is accurate or whether 10 toxicologists agree, or it doesn't matter. We will discuss all of those ideas in the workshop, and we will work through some examples. And here's another question for you. How many facilities do you think know in real time whether a worker is exposed above or below the OEL? I can tell you not many facilities know, and most rely on engineering specifications for brand new equipment. But filters clog, seals get brittle, blowers wear out, and all of this matters. So in our workshop, we will discuss risk management strategies and how exposure limits can inform risk management, but not dictate it. And finally, do you know that there is one thing you can do at your facility that will eliminate your need to have OELs for as many as 90% of your molecules? There is such a thing, and I will show you how to do it, and I will show you why it works. And as a final topic, can an OEL be used to determine risk-based cleanout limits? The answer is yes, absolutely. Mostly it's just a matter of arithmetic with a few caveats. And we'll do that too. So that's our workshop in a nutshell. To participate in the workshop, you will need a PC or a Mac computer. And if you want to talk to us, you need a video camera and a microphone and a good internet connection. And links to all the apps and everything else that you'll need for the summit can be found on the summit workshop. So until November, I'm Mark Maier, your risk assessment workshop coach for the virtual HPAPI summit on November 19th and 20th. This is going to be an awesome hands-on experience. I can't wait to see you there.